Sharing Christ, sharing life, Blessed Hope Broadcasting Services.
Good evening. Welcome to the 15th Annual Believers Convention of the Blessed Hope Seventh-day Adventist Church, Dartford. My name is Grace Adesina, and I'm doing the health presentation this evening. The title of this evening's presentation is Urinary Tract Infection. Urinary tract infection is an infection of the urinary tract. Lower urinary tract infection may involve the bladder, which is called cystitis, and the urethra, called urethritis. Upper UTI affect the kidneys, and the infection is called pyelonephritis. Symptoms of lower urinary tract infection: suprapubic or lower back pain, painful urination called dysuria, frequent and urge to urinate despite having an empty bladder, hematuria, which means blood in urine, vaginal discharge in women, and at times pus, visible pus in urine. At times, symptoms of lower urinary tract may be vague or non-specific in the elderly. Symptoms of urinary tract infection: this might be systemic and may present as fever, nausea and vomiting, flank pain, that is pain radiating from the side of the abdomen to the hip and back. Symptoms of urinary tract infection. In children, symptoms of UTI in children usually present as fever, and at times there might be a new onset of urinary incontinence. Infants might be feeding poorly, vomiting, sleep more, and show signs of jaundice. In the elderly, incontinence, change in menstrual status, and fatigue might be some of the symptoms. Some elderly people also present to the hospital with sepsis, and UTI is often picked up and as cause of sepsis during screening. Note, UTI has been associated with confusion, but there's no present evidence. Causative organism of urinary tract infection: E. coli. It is the cause of about 80 to 85% of urinary tract infection in the community. Other organisms might be a bacteria or fungi. Hospital-acquired urinary tract infection are caused by either E. coli, Klebsiella, Pseudomonas, Candida albicans, and Enterococcus. The risk factor predisposing us to urinary tract infection: the female anatomy. Women are more prone to urinary tract infection because their urethra is shorter and closer to the anus. That is, urethra, I mean the tube carrying urine from the kidney to the bladder. Menopause: due to decrease of the vaginal flora due to reduction of estrogen. Sexual intercourse is the cause of 75 to 90% of bladder infection. The term honeymoon cystitis has been applied to bladder infections early in marriages. Even though sexual intercourse is one of the risk factors for UTI, it is not classified as a sexually transmitted disease. Spermicide and diaphragm: it has been associated with risk of developing urinary tract infection. Diabetes is because of the excess sugar in the blood and in the urine. Obesity. Catheterization increases the risk of urinary tract infection. Male scuba divers who use condoms, catheters, and female scuba divers who use external catching devices are susceptible to UTI. Uncircumcised male and male with enlarged prostatitis are also susceptible to urinary tract infection. Diagnosis can at times be difficult in those with vague symptoms because they can be without symptoms even though the causative organisms is present. Urinalysis: the presence of nitrates, leukocytes, and red blood cells in urinalysis is an indication of urinary tract infection. Urine culture also can be taken. This shows the bacterial colony when urine samples are cultured and will show how sensitivity the bacteria is to specific antibiotics. This will inform the clinician on what type of bacteria to prescribe. Treatment: In uncomplicated urinary tract infection, treatment includes short course of antibiotics, usually for 3 days, while complicated urinary tract infection are treated with antibiotics for 7 days or more if needed. If symptoms do not improve, further tests might be necessary as to explain the cause. If urine cultures contain significant bacteria in diabetic patients, pregnant women, or immunocompromised patients, it is considered to be very, very complicated. This can result in sepsis in diabetic and immunocompromised patients and premature or low birth weight in pregnant patients. Dietary supplements. A 2023 review showed that cranberry products can reduce the risk of UTI in women with recurring infection, but not pregnant women, not in elderly or people with urination disorders. However, cranberry has not been effective when used to replace antibiotics for the treatment of active infections. Prevention. Urinate after sexual intercourse. Wear cotton underwear. Regular baths and showers. Personal hygiene after urinating and passing stool. A wipe from front to the back is advised to prevent the fecal contamination to the vaginal area in females. Parents changing young children, especially female children, should wipe from front to back when changing children after passing stool. Catheterize when it is necessary with aseptic technique and cover with antibiotics if catheterization is done more than one, especially in elderly patients. Passing urine in a sitting position improves bladder emptying in men with benign prostate hyperplasia. Thank you.
Sharing Christ, sharing life, Blessed Hope Broadcasting Services.